At week 37, your baby is considered early term, meaning they are fully developed and can be born safely without risks associated with prematurity. Your baby's brain will double in size during the first year after birth. The third trimester is a preparation for the most explosive brain growth that happens outside your body. The next few minutes covers weeks 28 through 40, the final stretch, when your baby goes from 2.5 pounds to 7+ pounds, when sleep becomes impossible, and when your body prepares for the most intense physical event of your life. Every fact in this video is verified by obstetric research, ACOG guidelines, and neonatal outcomes data. It contains just what's scientifically happening as you approach delivery. If you're in your third trimester right now, hit subscribe. This is the home stretch. Let's finish strong. Welcome to the final countdown. Week 28. You've officially entered the third trimester. And immediately, you notice something different. The second trimester energy is gone. The comfortable baby bump is now a full-blown belly that makes tying your shoes a strategic challenge. Your baby at week 28, about 10 inches long, crown-to-rump, or 14 to 15 inches head to toe, weighing approximately 2.5 pounds. What's remarkable about this week? Lungs are producing surfactant, the substance that keeps air sacs open. Production started weeks ago, but is now ramping up. Eyes fully functional. They can open, close, blink, see light and shadows. REM sleep cycles. Your baby dreams for 20 to 30 minutes at a time. Fat accumulation accelerates. Your baby will gain about 0.5 pounds per week from now until birth. Week 29. The brain is growing explosively. Again, remember the first trimester, when neurons were forming at 250,000 per minute? That's long over. But now the brain is doing something different and equally important. Myelination. What's myelin? The fatty insulation that coats nerve fibers, allowing electrical signals to travel up to 100 times faster. Without myelin, signals move at 2 miles per hour, and with myelin, signals move at 200 plus mph. That's massive, right? This is why premature babies have developmental delays. Their brains haven't fully myelinated yet. The process accelerates in the third trimester and continues through age 25. Your baby is now about 10.5 inches crown-to-rump, or 15.5 inches head to toe, weighing about 3 pounds. The head is getting larger, not just bigger, more wrinkled. The brain is developing gyri ridges and sulci grooves that increase surface area. A smooth brain means less processing power, and a wrinkled brain means more neural connections. Your baby's brain at week 29 looks increasingly like an adult brain, just smaller, finding their place. Week 30, your baby is running out of room. Those big somersaults and full-body flips from the second trimester? Physically impossible now. Your baby weighs about 3.5 pounds and is roughly 16 inches long head to toe. There's simply not enough space to tumble anymore. What you'll feel now, jabs and pokes instead of rolls. Defined body parts pressing against your ribs or bladder. Hiccups in the same spot. You can tell which end is up. Rhythmic movements as baby practices breathing. And something most women don't realize. Your baby can now distinguish between light and dark outside the womb. If you shine a bright light on your belly, they'll turn away or shield their eyes with their hands. Research using 4D ultrasound has captured babies literally putting their hands up to block light. They have a preference, and it's for darkness. The head down flip. Week 31. Most babies settle into their birth position. By now, about 70% of babies are head down, cephalic position. This is ideal for vaginal delivery because the head, the largest part, comes first and dilates the cervix, making it easier for the shoulders and body to follow. About 25% of babies are still breech, bottom or feet down at week 31, and most will spontaneously flip head down before week 36. Why the flip happens? Gravity. The head is heavier than the bottom, uterine shape. The uterus is pear-shaped, wider at the top, narrower at the bottom. Survival instinct. Head down is biologically programmed. If your baby is breech at week 31, don't panic. You have 5+ weeks of them to turn. Some techniques like spinning babies exercises, acupuncture, or external cephalic version, doctor manually rotates baby from outside, can help. Your baby at week 31. About 11 inches crown-to-rump or 16.5 inches head to toe, weighing approximately 4 pounds. The immune system is maturing. Your antibodies are crossing placenta in large amounts now, giving your baby passive immunity to diseases you're immune to. This protection lasts about 6 months after birth, which is why newborns rarely get sick in their first months. And something remarkable, your baby's bone marrow has completely taken over red blood cell production, previously done by liver and spleen. This is one of the final steps in blood system maturation. Week 32. This is a lung maturity milestone. Your baby at week 32. About 11.5 inches crown-to-rump or 17 inches head to toe, weighing approximately 4.5 pounds. What's developed? Fingernails reach fingertips. May need trimming immediately after birth. Toenails forming, still growing toward toe tips. Hair on head. Some babies have a full head of hair. Others are nearly bald, both normal. Taste preferences. Your baby now shows preference for sweet taste and amniotic fluid. And here's something wild. Research shows that babies at this stage can distinguish their mother's voice from other female voices and show increased heart rate and movement when mom speaks. They're not just hearing you, they're recognizing you specifically. Week 33. Your baby's skeleton is nearly completely ossified, except for one crucial area. The skull bones remain separate and slightly soft. Why? Because they need to overlap and compress during delivery to fit through the birth canal. This is called molding. After birth, you might notice your baby's head looks slightly cone-shaped or asymmetrical. This is normal molding and resolves within days to weeks. The skull bones don't fully fuse until age 18 to 24 months. The soft spots, fontanelles, allow the brain to grow rapidly during the first 2 years. Your baby is now about 12 inches crown-to-rump or 17.5 inches head to toe, weighing about 5 pounds. Fat continues accumulating. That fat serves 3 purposes: temperature regulation after birth, energy reserves for the first days of life, protection for internal organs, and something you'll definitely notice. Your baby's movements feel different, stronger, more forceful, sometimes uncomfortable. That's because they're bigger and their muscles are stronger, but they have less room to move. Almost there, but not quite. Week 34. You're in the late preterm window. Babies born between 34 to 36 weeks are considered late preterm. Survival rate is high, but they still have higher risk than full-term babies. What late preterm babies often face: difficulty regulating body temperature, feeding challenges, weak suck reflex, jaundice, liver still immature, possible short NICU stay for monitoring. This is why doctors try to delay delivery until at least 37 weeks, unless there's a medical reason to deliver earlier. Your baby at week 34. About 12.5 inches crown-to-rump or 18 inches head to toe, weighing approximately 5.5 pounds. What's remarkable about week 34? The central nervous system is maturing rapidly. The brain can now regulate body temperature, breathing rhythm, digestion. These were controlled by the brainstem, primitive brain, before. Now the higher brain centers are taking over. You should still feel 10 movements within 2 hours during baby's active time. If movements drastically decrease, call your doctor. Week 35, that protective white coating, vernix, starts coming off. Your baby has been covered in vernix caseosa since week 19. Now they're beginning to absorb or shed some of it. Babies born at 35 to 37 weeks often have more vernix than those born at 39 to 40 weeks. Vernix has antimicrobial properties and moisturizes newborn skin. Your baby is now about 13 inches crown-to-rump or 18.5 inches head to toe, weighing about 6 pounds. The digestive system is nearly mature. Your baby's intestines are producing meconium, the sticky dark green first stool made of amniotic fluid, lanugo, body hair, and dead skin cells. This will be expelled in the first 24 to 48 hours after birth. If meconium is passed before birth into amniotic fluid, it's a potential sign of fetal distress and requires monitoring. The classification of terms: early term, 37 weeks, 0 days to 38 weeks, 6 days. Full term, 39 weeks, 0 days to 40 weeks, 6 days. Late term, 41 weeks, 0 days to 41 weeks, 6 days. Post-term, 42 weeks, 0 days and beyond. Why this distinction matters. Babies born at 37 to 38 weeks, early term, have 2 times higher respiratory issues than 39-week babies, more NICU admissions, more feeding difficulties, slightly lower average IQ scores at age 5, 2 to 3 point difference. Those extra 2 weeks from 37 to 39 weeks matter significantly for brain and lung development. This is why ACOG recommends against elective inductions or cesareans before 39 weeks, unless there's a medical indication. Your baby at week 36, about 13.5 inches crown-to-rump, or 19 inches head to toe, weighing approximately 6.5 pounds. But here's the thing, weight can vary dramatically. Some healthy babies weigh 5.5 pounds at 36 weeks. Others weigh 7.5 pounds. Both can be normal. What's definitely happening at week 36? Lungs are mature, could breathe air independently if born now. Sucking reflex strong, ready to breastfeed or bottle feed. Fat stores complete. Body is 15% fat. Liver is storing iron. For the first 6 months after birth. Immune system functional, producing antibodies. Week 37, you cross into early term. Many women hear your full term at 37 weeks. Technically, your early term, not full term, which starts at 39 weeks. But practically, if labor starts spontaneously at 37 weeks, doctors won't stop it. Your baby is developed enough for safe delivery. Your baby is now about 14 inches crown-to-rump, or 19.5 inches head to toe, weighing approximately 7 pounds, though individual variation is huge. What's happening in the final weeks? Your baby is essentially just gaining weight now. All organ systems are mature. The brain, lungs, liver, kidneys. Everything works. From week 37 to 40, your baby gains about 0.5 to 1 pound per week. This is pure fat storage for temperature regulation after birth, energy reserves for breastfeeding establishment, brain development in the first weeks of life. And something important about due dates. Only 5% of babies are born on their actual due date. The due date is an estimate with a 2-week window, on either side being completely normal. First-time mothers typically deliver between 39 to 41 weeks. Subsequent babies often come slightly earlier. Week 38, this is where time slows down. You're uncomfortable. You can't sleep. You're peeing every 30 minutes. You're exhausted but simultaneously wired. You're checking for signs of labor every time you feel a twinge. Welcome to the final stretch. Your baby at week 38, about 14.5 inches crown-to-rump, or 20 inches head to toe, weighing approximately 7.5 pounds, average. Some babies are 6 pounds, some are 9 pounds, both can be healthy. What's happening? Not much developmentally. Your baby is fully cooked. They're just marinating, gaining weight, and waiting for the biological signals that trigger labor. What you might notice: Braxton Hicks contractions. Practice contractions that don't dilate the cervix. Lightning. Baby drops lower into pelvis. Can happen weeks before labor or hours before. Mucus plug loss. Thick, jelly-like discharge can be weeks before labor or day of. Nesting instinct. Sudden urge to clean, organize, prepare everything. None of these reliably predict when labor will start. Some women lose their mucus plug at 36 weeks and deliver at 41 weeks. Others have 0 signs and go into labor 6 hours later. Week 39. This is the optimal delivery window. Research comparing outcomes of babies born at different weeks found that 39 to 40 weeks has the best outcomes. Lowest NICU admission rates. Lowest respiratory complications. Best breastfeeding establishment. Highest APGAR scores. Best long-term neurodevelopmental outcomes. Your baby at week 39. About 14.5 to 15 inches crown-to-rump, or 20 to 21 inches head to toe, weighing approximately 7.5 to 8 pounds. What's different about the brain at 39 weeks versus 37 weeks? 2 more weeks of myelination. 2 more weeks of synapse formation. 2 more weeks of brain volume growth. A study found that children born at 39 to 40 weeks scored an average of 2 to 3 points higher on IQ tests at age 5 compared to children born at 37 weeks, both without complications. Those extra 2 weeks of brain development matter for long-term cognitive outcomes. Week 40, your due date has arrived, and nothing happens. This is completely normal. Only 5% of babies arrive on their due date. The majority come in the days/weeks after. Your baby at week 40, about 15 inches crown-to-rump, or 20 to 21 inches head to toe, weighing approximately 7.5 to 8.5 pounds, massive individual variation. What's happening now? Your baby is fully developed. They're not overdue at 40 weeks. They're right on schedule. The 40-week due date is just an estimate based on the average pregnancy length. But here's what you're probably feeling: frustrated, anxious, impatient, worried something is wrong. Nothing is wrong. Some babies just need more time. However, doctors start monitoring more closely after 40 weeks because after 41 weeks, there's a slight increase in placental insufficiency, placenta aging, meconium aspiration risk, stillbirth risk. This is why most doctors recommend induction by 41 to 42 weeks. Week 41, the late-term window. You're now in the late-term category. What happens at week 41? Your doctor will likely recommend non-stress tests. NST monitors baby's heart rate for 20 to 30 minutes to ensure they're tolerating the prolonged pregnancy well. Biophysical profile. BPP ultrasound checks amniotic fluid levels, baby's movements, muscle tone, and breathing practice. Cervical checks. Assessing if your cervix is favorable for induction. Natural induction methods that have some evidence. Sex. Semen contains prostaglandins, same hormone used in medical induction. Nipple stimulation triggers oxytocin release. Walking. Gravity helps baby engage in pelvis. Week 42. Very few pregnancies make it here. Only less than 1% of pregnancies reach 42 weeks because most doctors induce by 41 weeks. If you reach 42 weeks, most providers strongly recommend induction because risks increase. Placental insufficiency. Placenta stops functioning effectively. Oligohydramnios, low amniotic fluid. Macrosomia, very large baby, increasing delivery complications. Meconium aspiration syndrome, stillbirth risk. Babies born at 42+ weeks are more likely to have lower APGAR scores, require NICU admission, have feeding difficulties initially. Speaking of induction and labor decisions, if you want help with creating a birth plan, grab my birth plan and hospital bag checklist below. The link is right below. The 3rd trimester is hard. It's not as easy as it is sometimes painted. What nobody tells you. Sleep is almost impossible. You're up every 2 hours to pee. Your back hurts. You can't get comfortable. Baby is dancing on your bladder at 3 a.m. Everything hurts. Your back, your pelvis, your ribs, because baby is using them as a trampoline. Your feet swelling. Your hands, carpal tunnel from fluid retention. You're huge. You can't see your feet. Tying shoes is an Olympic sport. Rolling over in bed requires a 5-step process. Braxton Hicks contractions. Your uterus practices for labor by contracting randomly throughout the day, sometimes painfully. The waiting is psychological torture. Every day past 38 weeks feels like a month. You analyze every sensation. Is this labor? Is that a contraction? Why hasn't baby dropped yet? This is normal, and you're not alone. But here's what makes it bearable. You know it's temporary. Every uncomfortable night, every painful movement, every exhausting day is moving you toward meeting your baby. And when you finally hold that 7 to 8 pound human you sacrificed to meet for months, all the discomfort becomes a hazy memory. The 3rd trimester isn't about enjoying pregnancy. It's about finishing the marathon. And your baby? They're using these final weeks to pack on fat for temperature regulation, strengthen their sucking reflex, mature their lungs for that first breath, build immune defenses, store iron for the first 6 months of life. Let's put the 3rd trimester in perspective. 12 weeks ago, week 28, your baby weighed 2.5 pounds, lungs were immature, brain was smooth, survival required significant NICU support. Today, week 40. Your baby weighs 7 to 8 pounds, 300% weight gain. Lungs are fully mature. Brain is wrinkled, myelinated, functional, ready for life outside your body. Your body was performing miracles, producing 50% more blood to support baby, expanding your uterus to 500 times its original size, preparing your cervix to dilate 10 centimeters, loosening your pelvic ligaments for delivery, producing colostrum, first milk, in your breasts. You've been preparing for labor for 12 weeks. Your body knows what to do. So you've made it to the end of the third trimester. Now what? Labor will start one of three ways. 1. Spontaneous labor. Contractions start on their own, gradually increase in frequency and intensity. Cervix dilates naturally. Baby is born when ready. 2. Induction. Doctors sometimes have to induce a pregnancy to initiate labor. 3. Scheduled cesarean, usually for breech presentation, placenta previa, or previous cesarean. How will you know it's real labor? Contractions are regular. Every 5 minutes, then 4, then 3. Contractions are getting stronger. Pain increases over time. Contractions are getting longer, starting at 30 seconds, building to 60-plus seconds. They don't stop when you move. Braxton Hicks stop when you change physician. Real labor doesn't. When to go to the hospital. 5-1-1 rule for first-time moms. Contractions 5 minutes apart, each lasting 1 minute, for 1 hour consistently. Call your doctor or go to the hospital immediately if water breaks, especially if fluid is greenish, meconium, vaginal bleeding, severe abdominal pain, decreased fetal movement. If you want to know exactly what to pack for the hospital and how to write a birth plan that doctors actually respect, grab my birthing plan and hospital bag checklist below. It includes the items most lists forget. Link is right in the description. The third trimester is the longest 12 weeks of your life. Every day feels like a week. Every week feels like a month. You're exhausted, uncomfortable, and desperate to meet this human who's been living inside you. But here's the truth. The moment they place that baby on your chest, still covered in vernix, crying their first cry, eyes blinking at the bright lights, every uncomfortable night disappears. You won't remember the swollen feet. You won't remember the sleepless nights. You won't remember the back pain. And you did it while simultaneously living your life, working, sleeping, eating, existing. You're about to do the hardest thing you'll ever do physically. And you're ready. Your body has been preparing for 40 weeks. Trust it. Next video. What actually happens during labor? The 4 stages nobody explains properly, including the hidden 4th stage where complications are most common. Comment below. How did you navigate your third trimester woes? You're about to meet your baby, and it's going to be the most incredible moment of your entire life.